Republican leaders in the Senate are working toward a vote next week on a health care measure that many are calling their last best chance to repeal Obamacare. Republicans are trying to get to 50 yes votes on the Graham-Cassidy bill, while Democrats are fighting hard against it.
I think there's tremendous support for it. I think it's actually much better than the previous shot, which was very sadly let down. If this happens, it will be a great thing for the country.
When I see people trying to undo that hard-won progress for the 50th or 60th time, it is aggravating.
A vast majority of Republican governors are on board. They want the money. They want the power. They want to get health care out of Washington. They want to do it themselves, and I guarantee patients in this country will do better.
We're going to do everything we can to protect the health insurance of millions of Americans, and we know the Republican plan will take health insurance away from scores of Americans.
President Trump tweeted last night he will not sign legislation unless it protects those with pre-existing conditions.
I want to remind Republicans that health care isn't political, it's personal.
Republican Senator Rand Paul says he will not vote for this bill, while many others in the GOP remain undecided. Without Democratic support, leadership can only afford to lose one more Republican. So the head counting is on. Delaware Democratic Senator Chris Coons joins us now to talk about the health care debate. Senator, thanks for being here.
Thank you, Brett. Great to be on again.
Your biggest concern here?
Well, I listened earlier today to the leaders of Delaware's healthcare community, the head of our largest hospital, a representative from the American Cancer Society, folks who are charged with delivering health care, and folks who advocate for those who receive health care. And they were unanimously opposed to this proposal. That's also true at the national level. America's doctors through the American Medical Association, America's hospitals through the American Hospital Association, the AARP, which advocates for America's seniors, are all opposed to this bill because they see it ending Medicaid as we know it, putting a cap on how much the federal government will spend on any individual with Medicaid going forward, and they see it as creating chaos in the individual markets. Brett, I was encouraged over the last month by bipartisan progress that was being made by Senator Lamar Alexander, Republican from Tennessee, and Senator Patty Murray, Democrat from Washington, who had a dozen hearings together to hear from governors, from insurance commissioners, from health care leaders across the country. I felt like we were making steady progress towards a bipartisan compromise to address some of the challenges and problems with the Affordable Care Act. Instead, there's been an abrupt halt to that effort by the Republican leader of that effort, and now we're going to have a vote this coming week on this bill. I've got a lot of concerns about how it will affect Delaware and how it will affect the country, and I plan to vote against it.
So when they say this lets state governments take control, this is the ultimate federalism, how do you come back to that?
Well, that's one of the most positive arguments for the bill, is that it pushes back to the states the responsibility, the freedom, and the cost for providing for health care. Medicaid is a program that is absolutely vital for caring for low-income seniors who are in nursing homes or caring for children who are in children's hospitals. And my view, my faith, my perspective on how we care for others, for the least of these in our society, is that we should not reduce the number of Americans who have access to Medicaid, but increase the number of Americans who have access to high-quality health care through Medicaid. This pushes those choices back to states and would increase the cost to my state by $1 billion by 2027. I think we will genuinely struggle as a state to meet that cost.
A lot of Democrats say the pre-existing conditions clause in here is not firm enough. Here is how one of the co-authors, Senator Cassidy, answers that question.
The legislation says that nothing the governor asks for will be approved unless there is affordable and adequate coverage for those with pre-existing conditions. I worked for 25 years in a public hospital for the uninsured, sometimes treating those who lost their insurance because an insurance company cut them off because they had a pre-existing condition. My life's work has been taking care of those folks. We continue to take care of them in this legislation.
Is that good enough for you?
Well, Brett, there's two problems with this legislation, specifically on the point that Senator Cassidy was speaking about. First, there's no enforcement mechanism for that provision. If a state applies for a waiver, they are required to demonstrate how they expect that they will meet this concern about pre-existing conditions, but there's no enforcement mechanism.
Well, it's up to the CMS.
So our concern is that many states will apply, make a bare showing of how they will enforce it, but there's no way that the federal government can then hold them to that.
Well, let me just interrupt you, because this is the quote. Let me just interrupt you, Senator. Sorry. This is the quote.
Sure.
In the bill, the state must submit an application to include a description of how a state will regulate plans utilizing the dollars within the block grant, including how it will maintain access to adequate and affordable coverage for individuals with pre-existing conditions. So isn't that a determination that what adequate and affordable is up to the CMS administrator?
So what I'm saying, Brett, is that sentence is in the bill. That's correct. There's no definition of adequate and affordable. More importantly, there's no enforcement mechanism that says exactly how the federal government will hold the state to that description that they're supposed to provide. So health professionals from a wide range of backgrounds have criticized this bill as lacking an effective enforcement mechanism. There's also a provision that suggests that it is possible for health insurers to rate beneficiaries differently based on their previous health experience. I have a concern that that suggests that the ban that's in the Affordable Care Act on discrimination based on pre-existing condition will be easily overridden when states apply for waivers under this Cassidy Graham health plan.
I only have 10 seconds. Do you think they're close?
Do I think they're close? Yes. I think this will be a very close vote this coming week. And I think, frankly, everybody should be listening closely to the advocates for America's patients, for America's doctors, for America's hospitals when they raise real concerns about this bill.
Senator Chris Coons, thanks for the time.